New research suggests that removing fluoride from America's public water systems would increase costs for dental care and tooth decay in children. That study was published last week in the Journal of the American Medical Association Health Forum. It found that fluoride removal could result in more than 25 million cases of tooth decay and cost approximately $9.8 billion over a 5-year span. The Centers for Disease Control and Prevention says fluoride helps prevent tooth cavities. But Health and Human Services Secretary Robert F. Kennedy Jr., who has pushed for removing fluoride from all American water systems, he says the mineral is linked to health issues. Dental experts CBS News spoke with say they disagree with that claim. To talk about all this, Dr. Lisa Simon joins us now. She's an assistant professor of medicine at Brigham and Women's Hospital, also a co-author of this study. Dr. Simon, thank you for joining us. Tell us a little about your study's findings. What should we take away from this?
Thanks so much for having me. So what our study showed was a simulation of what would happen to all American children if fluoride were to be removed across the country. We looked at a 5-year span of what would happen and then a 10-year span as well. And what we found was that overall, there'd be a 7.5 percentage point increase in the amount of tooth decay in American kids, which is equivalent to more than 25 million newly decayed teeth. And of course, that has lots of costs. One of the ones that we simulated was the financial costs, which would be borne by both families and federal funders and insurers. But there are other costs as well in the form of toothache, suffering, and all the sorts of things that none of us would want for our kids.
So you talk a lot about the kids here. Who would be most at risk if fluoride was removed from the water systems in this country?
Fluoride benefits everybody. It does benefit adults' teeth, but it benefits kids' teeth the most because as they're developing, the fluoride can replace a different mineral in them and make them stronger. And one of the most amazing things about fluoride is that it comes straight from the tap. So it's available to absolutely everyone in a given area. The people who stand to benefit the most, of course, from that are the ones who would otherwise struggle to get access to things like routine preventive dental care. So while fluoride helps everybody, it lifts the people who need our help the most prominently.
So we talked a little bit about what HHS Secretary Kennedy has said about fluoride, how it's linked, he says, to several health concerns. How serious are those issues? And in your opinion, do they outweigh the benefits at all?
Fluoride has worked really well to prevent tooth decay for about 80 years. As of now, we have not seen any demonstrable negative health effects over that 80-year period that we can measure. Our study was a simulation, so we used the absolute best evidence that we have to support our projections. We did not include a model of any negative health outcomes because the best evidence we have, which is a monograph from the National Toxicology Program and the recommendations of the Centers for Disease Control and Prevention, does not find any evidence of health harms at the very safe and low level that communities add fluoride to the water.
Dr. Lisa Simon, thank you very much for joining us.
Thank you so much.